Okay, thank you. Right, can I start by saying to everyone, good afternoon and welcome to today's COVID Outbreak Engagement Board on the 21st of July, 2021. Can I say this? You've got me today, Paulette Hamilton. I am the chair of the Health and Wellbeing Board, and I also am the cabinet member for Adult Social Care and Health. Because unfortunately, the leader, Ian Ward, who normally chairs this meeting, he cannot be with us today. I'd like to welcome everybody to today's Outbreak Board, and as we now go into, I hope I got this right, I'm pretty sure I have, into stage 4 of the rollout of easing the restrictions. I'd like to start by saying we've got a lot to talk about today. So let me start by saying this webcast is being recorded for subsequent viewing via YouTube, and the press can access it via YouTube, but we will be using parts of this meeting. If we've got any confidential or exempt items, we will go offline at that point and do it privately. Please, can I ask those wishing to speak to indicate using the chat function or by raising their hands, and only speak when you're called by myself and I'm the chair. Please switch off your mic and your video when you're not speaking, because that's got something to do with the bandwidth, and we don't want to lose anybody during the meeting. Now, we have had apologies from Ian Ward, as I've said, the leader of the council, from the deputy leader, Bridget Jones. We've also had apologies from Chief Superintendent Graham, and we've also had apologies from Mark Croxford. Can I say at this point, if there are any declarations of interest, can you please record them now? I take silence that there are no declaration of interest. Can we move swiftly on to the minutes of today's meeting? Can I confirm that the minutes of the meeting that was held on the 30th of June, that they are an accurate reflection? Do you agree? Can I just
Great.
Okay, thank you. And we will move swiftly on to Dr. Justin Varney, the Director of Public Health, who will give the COVID-19 situation update. Justin, over to you.
Thank you, Councillor Hamilton. And although I'll share the slides, I'll only draw out for the board the highlights from the key points that I think is important to raise with the board today. But I'll just get them up for you. So we are, as you said, in now the 4th step of the roadmap. We are seeing an increase in cases both across Birmingham, the wider West Midlands region, and across the country. And that very much reflects the fact that people are now socialising more with each other. And that's also reflected in some of the different patterns we're seeing now in areas of the city that are experiencing very high case rates compared where they haven't had them high before. Sadly, some of those cases are translating into hospital admissions, and some of those into intensive care and mechanically ventilated admissions as well. We've yet to really see the impact on deaths. I would expect that to start to appear in the figures in about the next 2 to 3 weeks' time. As you remember from earlier in the pandemic, hospitalizations follow 3 to 4 weeks after community case rates rise, and deaths appear about another 4 weeks after that. So we're still in the period where we're starting to see the impacts of case rates rising 2 to 3 weeks ago are now translating into hospital admissions, and another couple of weeks before we see it coming through in terms of deaths. Moving through the slides, overall, as you can see, the upward trend is across the region. Currently in the West Midlands, Solihull has a higher rate than Birmingham. I think Sandwell is coming pretty close behind us. But in the wider West Midlands region, also North Warwickshire is flagging particularly highly as well. And I think both Solihull and North Warwickshire are now in the top 20 nationally in terms of case rates. And as you can see from the map, that there are a similar number of cases in lots of different parts of the city. The rise that we've seen over the last week or two is affecting the whole city. This is not clustering to a particular geography or a particular ethnic group in the way that we saw perhaps in the autumn at the beginning of the second wave. This is now much more diffuse across the city. When we look at the wards where the highest case rates are, you'll see for the first time wards in Sutton Coldfield are in the top 10 in the city. This is the first time, I think, in the whole pandemic where these more affluent areas of the city have seen very sharp increases in their case rates. What we think is going on there is that many of our more affluent citizens have been able to work from home during the pandemic and really haven't been out socializing particularly or mixing, and so have been much more protected than some of the parts of the city where our more deprived citizens have had to be going to work and have worked in frontline roles in health and social care, so have been exposed throughout the pandemic. And so in some of the wards that have had historically low rates, now people are out socializing more. Those that work in offices are starting to come back into the workplace again. We are seeing those case rates shoot up again in those areas for the first time. So fortunately, many of these areas have high vaccination rates. And my hope is that will buffer the NHS to some extent against the impact of these rapid case rate rises. But overall, the direction of travel is definitely up, and that's reflected in what we're seeing in the wastewater sampling as well. In terms of variants of concern, as I think we presented last month, Birmingham is now a city where the Delta variant is the dominant variant. And we're seeing very small proportion of cases which are not the Delta variant, which in some senses is the pattern across the UK, that the Delta variant is now the dominant strain across the UK. And sadly, that's what we're seeing across Europe in terms of rapidly rising cases, particularly in Northern Europe, is being driven by the Delta variant, and also now in the United States as well. In terms of testing uptake remains good. We continue to maintain footprint of sites handing out testing kits for the rapid testing, and we also maintain testing facilities for people who would like help doing a lateral flow test through 104 pharmacies across the city as that additional opportunity for support. The uptake of symptomatic testing through the PCR remains stable. We know as the case rates are rising across the country, there will be some delays in people getting their results. There is a finite lab capacity for these tests to be done. And unfortunately, I think we will see some rockiness over the next couple of weeks as case rates continue to rise, with people having to wait a couple of days more for the result of their PCR test. But it is important people do this test if they have symptoms, and that they isolate until they get the results. And if that result is positive, they continue to isolate with their household for the full 10 days. When we look at the uptake of lateral flow, what I've included here is a comparison between 2 weeks. And what we're seeing in the positivity coverage is actually the positivity in lateral flow looks like it's increasing in the darker areas, but overall there is some reduction in the geographical coverage. But the point that I suppose I wanted to make most is that this is looking at the uptake of lateral flow testing across the city. And what you can see is, first of all, the baseline, the lowest proportion, that's where the colour is lightest blue, has increased from 1.1 thousand to 1.3 thousand per 100,000 population. So overall, the whole testing rate in the city has improved significantly and continues to improve. And that's really good news, because it means that people are testing regularly. That phrase of lateral flow before you go is starting to resonate with people, and people are thinking and going, I'm going out to restaurant, I'm going out to the cinema, I'll just do a lateral flow test before I go and make sure I'm not going to put other people at risk. And that's really what we want to see, because that's what will help bring things under control. Testing rates, when we look at demographics, I don't think there's anything particularly to highlight to the board. What's positive is we've seen a generally consistent trend across ethnicities, some changes between different age groups. We've certainly seen that the impact of the students, to some extent, leaving the city at the end of term has changed some of the uptake with a particular age group, but in general, there aren't any particularly concerning trends. Wanted to make the board aware of the work that we did and part of enhanced support. That has now come to an end. So this was a period in which Birmingham was hoping for additional support from government to respond to our rising case rates. And we were focusing on 15 wards where we had the highest or rising case rates, low vaccination uptake and low testing uptake. One of the benefits we had from enhanced support is we were able to access more lateral flow kits, and we mobilised using our own resources from the existing COVID funding, door-to-door distribution of the lateral flow. And I thought it was useful to show the board what the impact of that has been. So the teams knocked on 78,609 doors across 15 wards of the city. Of those, 80% of the doors were answered, people were at home, and we handed out over 82,000 boxes of self-test kits. And that's about 60% of homes took a kit. When we look at the reason why people refused the kit, and this is a slight update to the online slides, and we will be updating and uploading these slides later this afternoon, because this is data that I've only just received back from the consolidation work we've been doing. We looked at the reason people refused. So if someone said, I don't want a kit, that the people handing out the kits did say, well, can you tell me why, so that we can get a sense of what's going on. Of the 13,780 households who refused a kit, about 20% had already tested. A proportion had said they didn't want one because they'd just been vaccinated, although it is important to say people who've been vaccinated should continue to test. But there were a large proportion of these people in these households who simply said, I'm not going to test. It doesn't matter what you say, I'm not going to do the test. Please leave me alone. And that was about 76% of these households where there was refusal. And that really just, I think, is important statistic to share and to flag, because it really highlights that, we still have a proportion of people who don't want to do the test and don't want to know if they have COVID. And that's a real risk for the city, given where we are on vaccination, and we still have a way to go. We did look at what the impact was at an individual ward level, and in all wards bar 2, we saw an increase in the overall testing rate. So we compared the testing rate between the 5th and the 11th of June and the testing rate between the 9th and 16th of July to look at what the impact has been. Now, the door-to-door work started at different dates in different areas, so there is some variation there. And I would really be saying that more than a 5% change in either direction, it would be something that we would consider statistically valid and a visible impact. And as you can see, actually, the negative impact, the ones where we've seen a fall in testing rates, are all below 5% and somewhat marginal. And we have about half of the wards are over a 5% increase. And in many of those wards, there are areas where we did door-to-door testing early on in that period, and that has been maintained for some time, which really reinforces that this mechanism of direct engagement does have a positive outcome, and that does last beyond the actual period in which the intervention is done. As we came into the 4th step of the roadmap, we agreed with government there was no point continuing the enhanced support, particularly other areas in the region were now experiencing case rates that are higher than us, and we had completed the door-to-door testing. However, there continues to be work through the NHS focusing on those wards with the lowest vaccine uptake, and I'm sure NHS colleagues will cover that shortly, to try and reduce the inequalities gap when it comes to vaccination. And we have seen some real improvements actually in some of these areas in terms of the vaccine uptake. So moving on quickly to case demographics, what we saw a couple of weeks ago, I think when I presented to the board last time, was a very rapid increase in the student age population, particularly secondary school students and the 20 to 25-year-old age group. That has started to stabilize now, although it's fair to say the majority of outbreaks that we have are associated with educational settings. But what we have seen, particularly in the last week, is quite a marked increase in the 20 to 39 age group. And that has been very much linked to socialization in hospitality and workplace outbreaks in hospitality and retail and manufacturing. When we look at the demographics by slightly different age groups, as you can see, everything's moving into that dark black color of very, very high case rates. But I do want to highlight particularly that the top two rows, that over 60s and over 80s age group, where the case rates have remained very low, and that really is showing the impact of vaccination. We are seeing good evidence now that although having 2 doses of the vaccine isn't perfect at stopping you catching coronavirus, it does significantly reduce the chances of you catching it. And that's why we are seeing case rates lower in this age group. So not only does it stop you dying from coronavirus and stopping you becoming extremely unwell, there is evidence that it reduces transmission and your likelihood of becoming infected. In the younger age groups where we don't have vaccination coverage, as you can see, those case rates continue to climb quite sharply. So moving on, ethnicity, I think the only thing I would highlight is that the case rate in the white population has increased quite dramatically over the last couple of weeks. And I think that reflects the increase in case rate in some of our more affluent wards. And as I said, I think that is a reflection of people now returning to work and socialising more where they've not been in employment sectors where they've had to work away from home during the pandemic. So we think that's what's going on. It's a similar pattern being seen in other parts of the West Midlands and also in some other parts of the country where the case rates in more affluent areas where people are in more office-based jobs are suddenly shooting up compared to where we've seen them previously. Moving through then in terms of the NHS situation, we are seeing an increase in daily admissions with COVID. We are seeing an increase in inpatients, and we are now starting to see an increase of patients who are in intensive care and on ventilation. And I know there is some anxiety in the NHS, and I'll leave it to NHS colleagues shortly to comment on that, but that this is the beginning part of the wave. As I've said, the case rates, what this is reflecting is the case rates in the community 2 to 3 weeks ago. So this is likely to climb quite markedly. And as you look at the graph which describes the picture, you can see we are on an upwards trajectory at the moment. However, in terms of deaths, the death numbers remain pretty stable and relatively low at the moment. So my hope is that vaccination has broken the connection with deaths. In terms of situations, we have seen situation numbers increase quite markedly. I have to say my team and environmental health are under a huge amount of pressure at the moment, particularly supporting schools and education settings where we've had a massive increase in situations over the last 2 weeks. And we continue to provide advice and support to settings to try and manage and control outbreaks. What we're also seeing is larger outbreaks than we've seen previously. So we are seeing workplaces with quite large numbers of staff now testing positive. And through the common exposures, those sites where people have been in the period in which they were likely to have caught COVID, we are seeing workplaces now increasing in frequency where they weren't a few weeks ago. So we are seeing some change in the pattern, which reflects the fact that people are out socializing more and connecting more. In terms of contact tracing, I think the key point to highlight to the board is that we've now stood down the local O response to contact tracing. As we are now seeing about 4,000 new cases in a week, we do not have capacity to continue that level of intense follow-up, and therefore we've taken the decision to stand down local O and revert to the original national system. We're working now to prioritise where we do contact tracing, and we'll be moving into an area of prioritisation over this week to try and manage the capacity we have appropriately. I won't dwell on the communication engagement slides. They're there for you to the board to read at your leisure. We continue to invest in engagement communication, working closely with the NHS to support the approach on vaccine awareness and answering questions and concerns about vaccination, but also supporting the messaging on isolation and helping people to really understand what personal responsibility and personal risk assessment means. And our COVID champions continue to grow. We're now up to 855 champions, and we have 48 youth champions who are also working with us, and they continue to be a really important way for us to disseminate information into communities directly, but also to hear back from them what is concerning them. Similarly, our engagement with faith communities continues to be an important pillar of our engagement, our understanding of what's going on in the community. And we've also been working with the NHS and our commission partner Solutions for Health, now doing door-to-door engagement in specific areas to make communities aware of pop-up vaccination, to answer their common questions and help to engage them to get people who have not yet been vaccinated over the line and get them protected with the vaccine. As I said, I won't dwell on this. We've included some spotlight information and also some information on next steps in terms of engagement. I hope that's helpful. I'm happy to take any questions from the board.
Right, Justin, the first question's from Paul. Paul, over to you for your question.
Thank you very much, Paulette. To say I didn't want to see Sheldon at the top of the league is an understatement, with 120 positive cases. And this has happened over the last few weeks because we went 5 weeks without any positive COVID tests at all. Now, given the high number of vaccinated people in Sheldon, I'm making the assumption that this is very much educational based within Sheldon Ward, because we did manage to get down the age spectrum quite well in Sheldon. So I'm making that assumption. Can we drill down at all, Justin?
So I will, outside of the board, Councillor Tilsley, I'll see whether we can get a profile for you of your ward. We've been trying to profile the top 3 or 4 wards to look what's going on. As I said, we are seeing in these areas, you're right, a particular spike in children and in unvaccinated, and even in the wards that have done really well on vaccination, we tend to still have quite large numbers of 18 to 29-year-olds who are unvaccinated. So in these wards that are spiking up, it's very much that under 30 down to about 14, 15 seems to be the age group who are really catching it and spreading it at the moment. And of course, they're the ones that are out socializing a lot with the nice weather and with some of the freedoms that have come. So, but I will, outside of the meeting, provide you with a more detailed breakdown for your ward.
Okay, that would be helpful, and I hope it won't be on a confidential basis, because I do try to keep my network informed of what is happening as far as positives are concerned. Thank you, Justin.
Right. Dr. Islam?
I think Stephen was before me, Councillor. I wouldn't want to jump the queue.
Okay, well, let's go to Steve. I haven't seen Stephen. I saw yourself. I don't often miss, so forgive
I don't mind.
Stephen.
I don't mind.
Stephen, if you go first, then Dr. Islam, and then Justin can answer both questions at once. Okay, so Stephen Raybo.
So there's a couple of things. The first is just to note that there's lots of information we get from the social care workforce about the pressure that's on them in terms of staff absences, having to isolate, and it would be useful to get a collective response to that going forwards. The other thing is that the papers to SAGE seem to indicate, and I'd be happy to be corrected on this, that the Delta variant, that the R rate of the Delta variant would mean that there wouldn't be herd immunity achieved through the vaccination program. And I'm just wondering what community capacity we would need going forward to mitigate that, and whether some time in future boards could be given to discussing that.
Dr. Munir, before you start to ask your question, can I ask everybody who's going to be asking questions, introduce who you are, because I haven't done it at the beginning of the meeting. So I apologize, but please introduce who you are. So over to you, Dr. Munir. And before you start, can I say Stephen Raybould is from BVSC. He's one of their senior managers. Thank you. Over to you, Dr. Islam.
Hi, my name's Dr. Aslam. I'm a GP in Ladywood, and I'm the chair of the West Birmingham Place on the Black Country in West Birmingham CCG. Justin, we've had a challenge of communication, to say the very least. Freedom Day has happened at a time where we've got some of the highest infection rates that we've had since the kind of second wave. You know, we're talking about 450. Or around that mark in West Birmingham. I went to, and if I could take the opportunity to say Eid Mubarak to all those Muslims out there celebrating as well. I celebrated yesterday. I went to the mosque. They'd unfortunately decided to abandon social distancing. The masks were supported wearing masks, but I would say probably a third of people were wearing masks. I'm just wondering what kind of environment we're creating at the moment, at a time where there is significant amounts of virus in our community, and if this will become a pandemic of unvaccinated people. You know, those 75% of the people in ventilated beds at the moment are unvaccinated. So I think it's just, we need to think collectively together. There is an NHS response saying that actually our infection control processes will be the same as they were before. There is no change for us. You will be expected to wear a mask if you enter a healthcare setting, and I think that's absolutely the right thing to do, given where we are. But it's a massive communications challenge, and I just wonder, you mentioned community leaders, I just wonder what kind of information we're giving them to maintain a level of control over this, because I think we need to take a safety first approach.
Right, Dr. Varney, over to you. Thank you.
Great, thank you. So in terms of just the first points from Stephen, the announcement on Monday around the rare occurrence where isolation for contacts can be exempted for health and social care staff was put into the public domain the same time it came to us within local government. So there is a rapid piece of work going on at the moment across the system. It's across both adult and children's social care and the NHS, so that we all use the same risk template and that organisations get the same steer. But it should be the absolute exemption. This should be an exception, not the rule, because by bringing individuals who should be isolating because they've been in close contact with a confirmed case into an environment where they are working with vulnerable people by definition because they're providing care is a high risk strategy. And it's really clear in the guidance, the national guidance, that the liability lies on the employer and that organisation. So it is not a decision that should be taken lightly by any employer, but we absolutely recognise that the amount of people isolating, because as case numbers go up, the number of people who are contacts goes up as well. It is creating that pressure. But it is important to recognise that there is no legal cover for the liability for organisations who choose to use that exceptional circumstances for exemptions. And we're working on guidance to make that absolutely clear, so organisations really understand the potential risk they are taking and therefore use it as an exceptional tool. And it has to be done on an individual by individual basis. There is no blanket exemption, so each person has to be assessed separately, and that has to be signed off by the accountable officer in the organisation who's responsible for health and safety and infection prevention and control. So we are working through that template as fast as we can. But as you're aware, the guidance came out on Monday. Well, the press release came on Monday. Actually, the guidance didn't come till a little time afterwards. And even then, it's very, very high level. In terms of the thinking from SAGE and the Delta variant, we are unlikely to get to herd immunity until we get 90% of the population vaccinated. We'll be near enough if we get over 80 to 85% vaccinated. But to get true herd immunity, you've got to be over 90% vaccinated. And we're nowhere near that at the moment. So herd immunity through vaccination is still quite a long way off. And whether it's Delta, Alpha, Beta, or whatever comes next, what we also know is that natural immunity doesn't last very long. So if it did, then we'll be in a better position, because you kind of get vaccine immunity plus natural immunity would probably get you over the line. But what we're seeing is that natural immunity, particularly to some of the new variants, is really not very good. So it's not giving us enough protection. I haven't seen them do any national modelling of this. There has been modelling of what the impact is on, particularly on healthcare in terms of hospital admissions. And as we've had through each of the waves, there's best and worst case scenarios. And at the moment, from the last version I saw, we are tracking along the kind of better side of the curve, if that makes sense. But I think, herd immunity is not something that's going to happen in the short term. Finally, on the question around comms and engagement, we continue to engage. We continue to meet faith leaders on a weekly basis. We had a specific meeting planning for Eid, and there was a letter that went out to all of the mosques in the city, reminding them to take precautions, reminding them how important it was. So it is disappointing to hear, Dr. Aslam, that was your experience in one of the local mosques, because that is not what they've been saying to me. And all the mosques have been pretty good at saying, actually, we're going to continue as normal and we're going to encourage people to wear masks. The challenge that not just our mosques, but our retailers have as well, is government took the decision to remove the legislation. So there are no enforcement powers now. So what happened on Monday, and I don't like saying Freedom Day because it wasn't Freedom Day, it was the day that the fines disappeared. COVID didn't go away. COVID didn't get less dangerous, didn't get less common. It's still just as big a risk. And what is heartening is how many venues, how many businesses across the city are just carrying on as normal. But it has to be the business choice. We can't force them. We don't have the local powers to be able to force it to happen. The mayor in the West Midlands has done his best with the transport system to get a consensus agreement. But again, it's, we want you to wear face coverings. We can't make you wear them because we just don't have those powers. They sit at a national level. But we continue to engage with community leaders. We're briefing our COVID community champions this evening, and we have more of the kind of webinars and engagement sessions planned. And we're continuing to go with ward forums and work with elected members as well in local communities. And all of that is very much hand in glove with NHS comms and engagement. The final thing I just say on that is I'm delighted that we appointed an engagement and comms person in my team to work jointly with West Birmingham specifically. And so that person started on Monday to give us some additional resource and some additional focus on West Birmingham, particularly around the vaccination programme, to try and help drive those numbers up.
Right, thank you for that, Justin. I've just got one question for you relating to the app. There's been lots of things said in the press and other things that I've seen to say that quite large numbers of people are switching off their app or deleting them. What will be the implication of this if this is really the trend and it's happening quite a bit? Yeah.
So I think there are two things. I think that what National are telling us is there's a lot of noise, but actually when you look at the app downloads and the app usage is that it's still being used a lot. The implications of not having the app switched on for us as individuals is we might be exposed, we might have caught COVID and we won't know. And therefore, we're taking it home, we're taking it into our friends and families. We're acting like we haven't got COVID and we have, and we're spreading it around. And what the app does is it's getting better, and they are tweaking it to make it even more sensitive. It's looking at how close you are to the person who tested positive and how long were you in that vicinity for. So what people are getting a lot through the app at the moment is what we call inform and warn. So I had one, for example, yesterday. I went to a restaurant at the weekend, pretty sure that's because that's the only place I went that wasn't home. And I got a ping through the app that says you've been in a building with someone who tested positive. You don't need to isolate, but you need to be aware. So that if I develop symptoms, I might think a bit faster register about getting a test. So there's quite a lot of inform and warn going on. And then the second layer of that is people who have been in close contact. If you haven't got the app switched on, you won't know you've been exposed. And if you don't know you've been exposed, you might have got COVID and you're going to spread it around. And then we're going to have case rates continue to rise. And then there's a very real risk we will see lockdown come back. So, you know, I think at the moment, I keep your app on, keep checking in at places, because it's the best way of trying to contain this. And it's also the best way to know if you've been put at risk.
Thank you for that, Justin. Unless there are any other questions, and I haven't seen any more hands up, we're going to move to item 7. And item 7 is about the vaccination rollout and uptake. And on this item, Paul Jennings will be speaking, and also Dr. Munir Aslam. I apologize for how I said it the last time. So, Paul, over to you. Thank you.
Thank you, Councillor Hamilton. Hopefully you can see me now on the screen. My team have really got their fact act together for today's meeting. There are 3 presentations in the pack, and you'll be pleased to know I'm not going to go through any of them. I'm just going to draw out some key facts and some key elements, and obviously invite any questions on the detail that people might have. Can I just begin by saying thank you to Justin and his team for helping us to put this information together. It's quite difficult for us to compile geographical information in NHS. Our information is based around general practice rather than around where people live. So we've really needed and valued the City Council's help in putting this work together. So building from where Justin was saying about the impact on the NHS, those figures that he had were about a week out of date, and there is no doubt that things have got considerably more difficult over that last week. I don't know what proportion of the people in Sandwell and West Birmingham hospitals are in the Birmingham side of the hospital, as it were, but certainly we know that in the 3 UHB hospitals that are taking COVID patients, there are now around 200, and that's a fairly steady number. The number in ITU is building still, and I think that probably follows the pattern that Justin was talking about, which is that we begin by people having the virus, then people become ill, then people become more ill and move into ITU and so on. There is a natural progression there. The number that we have in ITU is having an impact on our ability to provide other services, inevitably. We are also struggling to some extent because of high levels of staff unavailability at the moment. The new policy that came out as a press release, and then in a slightly more detailed way, is being used by NHS services to where they can bring people back into work who've been doubly vaccinated into work in situations where they don't pose potential risks on the basis they also have daily tests. So things are pretty difficult again. People are working really hard, and it's getting quite tough. The good news, the very clear good news, is at these level of case rates in our previous spikes of the virus over the last 16 months, at these current levels of case rates, we would have had far more people in hospital than we do now. It's really clear, looking at how the situation was previously to how the situation is now, that the level of case rate is not converting into the level of hospitalisation that we saw previously. As I say, that's not to say things are easy, but it demonstrates that's the case. Also, as Dr. Aslam said, and he's quite right, the majority of people who we are seeing in hospital, and certainly the majority of people who we're seeing who are really ill in hospital in the ITU, are people who've either had only one or no vaccination. So that there is an unequivocal, demonstration here locally that the vaccination programme works. We are having to work really hard to try and encourage people to take the vaccine up. It's harder in some places than others. And if you look at the situation across the city, there is a very clear geographical distinction about where uptake is good and where uptake is not so good. So in some areas, it's over 80% in some wards it's over 85%. across the central belt of the city, there are still many wards who are around the 50% uptake level. As Justin's described, we're working really hard in those communities with faith groups, with community groups, with local councillors, with GPs, with pharmacies, to encourage people to come forward for the vaccine. We've got 4 mobile vaccine vans, I think it is now, that we deploy. We try to plan where they're going and advertise where they're going to encourage people to come to them. We're trying pop-up vaccination centres to encourage people to take up the vaccine. It was always going to be tricky for us as a city, in part because of the population shape of the city as well, because we have so many young people. As we move down the age pyramid, when we got to the 30s and unders, we got to the largest cohort that we'd had, some months into the programme. And of course, for those younger people, we're trying to encourage them to come forward for their vaccines and saying how important it is at a time when they're seeing on the television tens of thousands of people gathered for all sorts of mainly sporting events, and saying, well, that they're all doing that, clearly what's the problem? So we're having to work really, really hard still, and we're grateful to all of those who work with us in trying to continue to promote the uptake of the COVID vaccine. It's worth just flagging up a couple of things that are coming up. We don't have details yet, but we're starting to try to plan. It's always difficult to plan when you don't have the details, but we are starting to try to plan. Coming up shortly, as it were, we're going to attempt to have yet again an even larger impact on flu vaccination. The combination of the flu vaccination programme last year, and I suspect social distancing, when we've had a record good year last year for flu. It won't last though, so we're going to have a really massive impact on uptake of flu vaccine this year if we're going to keep the flu in place. We're looking to do flu alongside a booster vaccination of COVID for the over 50s and for those who are clinically vulnerable. And we're looking also now at a programme of immunisation, COVID immunisation vaccination for children, but only those over the age of 12 who have some other compromising conditions. So not a general population vaccination programme at this stage, but one for children who are vulnerable. So planning is starting for those. I think I ought to say as well that all of this is happening in a context where you've got a health and social care workforce who have worked flat out now for 16 months. You've got a primary care system who are facing, I know unprecedented is an overworked word, but I'm sure Dr. Aslan will back this up. Primary care facing unprecedented levels of demand, up by 20%, 30% compared, and more in some cases, before the COVID pandemic. So people are having to work really, really hard. And anything that we can do collectively and individually to encourage people to simply come forward and take up this vaccine, anything that we can do to encourage people to help us in the education programme to dispel the myths and the nonsense that are going around about this vaccine programme, then the better for all of us in terms of trying to bring an end to this very, very troubled period. Thank you, Councillor.
Sorry, thank you, Paul. Can I go straight over to Dr. Haslan? And when you finish speaking, Munir, we will then get Paul's question. Thank you. I keep having to put this silly camera on and off, and it's causing me pure confusion. But anyway, we won't go there. Over to you, Dr.
No, I'm grateful for Paul's update, and I think it covered most of the things. But I think there's a bit about communication here, isn't there, Councillor? We're in a stage where we've got COVID infection rates that are just so high at the moment. There are 450, 500 in Birmingham, and we're at a time where we need to restore and recover services in primary care, in community services, and in secondary care. So we're trying to get on top of that, and that's in with a background of trying to create an infection control process that doesn't expose our most vulnerable people to COVID when they come in, or to any of the other viruses when they come in to see us. And it's a conundrum that is becoming more and more difficult as the rates increase. It will become more and more difficult as we've got, significant amounts of our population have not been vaccinated, and so that they are a vulnerable group now. So actually, creating an environment for the 30-40% in some cohorts where they've not been vaccinated, where we need to continue to maintain their medical care, continue to support them with their diabetes care or COPD or their chronic kidney diseases. Get them vaccinated, get them screened for in the cancer programs. It's just a massive conundrum, and this is on top of that, like Paul described, we're going to go into a period of time now where we will try to vaccinate as many people as possible with flu, do a booster campaign as well. And this is at a time where I don't think the peak of COVID will, from all the estimates that we're getting, will be for this wave will be sometime either late August or into September when we're planning on running that campaign. So I think this is just a combination of very difficult things that are happening all at the same time. So we will continue to do all of the things that Paul has said. Continue to have mass vaccination sites, continue to have your GP practices having vaccinations available, continue to have the opportunity to go where you like to have a vaccination. We've got almost 20 pharmacies in West Birmingham now that can deliver COVID vaccinations. We just need to work together to get through this, because actually it's been a difficult 18 months. The next 12 months is going to be very difficult as well, and I don't know when we'll be able to get on top of the backlog. So I think it's just, I would say, yes, we've worked very hard. There's hard work coming our way. We need to balance that out with not exhausting our workforce in a way that makes them unwilling to work in a health service that doesn't support them. So I think there are some difficulties here. We've got those two viruses that we've talked about, then we have to think about the vomiting viruses like norovirus, and then we're going to have viruses in children as well that will increase through this period. We just don't know what lockdown has done in terms of, we know that it's exposed children to less viruses, but actually when that starts, when children are back together in the winter period, we really don't know what the effect of that will be. Usually lower respiratory tract infections and upper respiratory tract infections will take up a lot of GP work going into the winter, so we have to just balance that out as well. Is there going to be a rebound effect with all of the other viruses that sit in our community? So I think there's difficult times ahead. I would echo Paul's words that if you haven't had a vaccination, please have a vaccination. Not just for the reasons of protecting yourself from COVID, but actually there's a lot on everybody's plate at the moment. And a vaccination will reduce the burden on our health services and our community. So I would just encourage people, if they haven't had a vaccination, please have your first. Make sure you get in time for your second, and then we'll get in touch about the booster campaigns.
Right. Can I say that I wholeheartedly support what both of you have said? I have to be honest, I don't know how health and social care will stand up to this winter. The staff are exhausted, they're beyond tired, but they push on, and they are a brilliant bunch, which I love dearly. But I still am concerned about how will they cope with this winter. I've received my COVID passport, and that little pass letter. I'm delighted, and I'm going to put it onto Twitter. I haven't done it yet, but I plan to. I feel as if I can't explain how happy I feel to get that little letter to say I've done it. It's as if I've passed an exam, and I cannot understand as a Black woman why so many people in my community are so, I know what the history has been, but I am saying it publicly, why they will not take the vaccine. We have had a lot of negative messages out there, but the vaccine is the way out of I was going to say the restrictions, but the government has already told us we're out of restrictions. So out of the way to get rid of this virus. But I truly believe, like yourselves, something is brewing, because the young people have stopped listening. It's worrying, but they have stopped listening. But we have to, as much as possible, keep plugging that same message. Go and take your vaccine. Parents out there, tell your children, go and take your vaccine. Doctors, call them in, because a lot of youngsters, my youngest, she hadn't got a doctor hadn't got her mobile number. So she felt it was okay. So when I've got this saying in my house, Justin laughs when I speak, but no one stays in my property and they are not vaccinated. They're not vaccinated. So she then, I rang the doctor. The doctor sent the text message, and off she went, because her doctor had now sent it to her, because she didn't want to just walk into a centre. She wanted to go to the GP, and they do lots of sessions. So that's how my youngest got vaccinated. But I just want to say to everybody today, it is truly important that we go out and we encourage our young ones, our children, our grandchildren, to go out and take that vaccine, because they all you hear the youngsters say, it's Freedom Day, we're going to have a nice summer. But they do not want to end up with COVID-19. And so at the end of the day, having a nice summer is one thing, but it's the consequences of it. And so I'm just saying to everybody, parents, encourage your children. Grandparents, encourage your children and your grandchildren to have that vaccine, because it is the way out of this issue. Because our workforce cannot stand up to what they have stood up to over the last 16, 17 months. They need us to support them. It's not just about protecting the NHS. We need to protect our loved ones, because half my family work in the NHS. So we need to protect them. Right now, one of my sisters, a couple of my cousins are off sick from work. It's taken them out, because they are so ill. So that was my message to everybody. So can I go over to Paul, and thank you, Paul, for listening to me rant on. Thank you. Your turn.
Thanks, Paula. It's a question to Paul. Are the positive hospital admissions still being directed to the QE site?
So, Councillor, patients are presenting at all of our A&E sites, potentially with COVID, and there are COVID patients in 3 of the UHB hospitals. We are maintaining Solihull Hospital still as a green site in order to carry out safe elective surgery. I'm not sure what the situation is with respect to the West Birmingham hospitals. I pass to Councillor Aslam for that. Sorry, Dr. Aslam. I promoted you to councillor then, didn't I? Sorry.
Yeah,
I was just wondering if it was
sure whether that was a promotion or a demotion.
That's exactly the point I was just going to make as well. It's not clear to me, but I'll take it as a promotion because I'm in a local authority event. I think the point Paul makes is really important. Actually, when your rates go significantly higher, patients with potentially COVID go to every place. They wander into our walk-in centres. They come to general practice. They go to our A&E departments, and they are put on the appropriate pathways. We have rapid testing now that enables us to decide which streams they fall into. But actually, if the rates were 30 last summer, and we were worried, they are 500 now, and so it's very difficult for us to run a program that just keeps one place completely COVID-free. It's nigh on impossible. So the rates really need to come down. We need to, adhere to social distancing if we can, get vaccinated. The people being admitted, let's be clear about it, 75% of the people in intensive care beds are unvaccinated people. The people being admitted into hospital that require oxygen are unvaccinated, the vast majority of them. So let's be clear about it. If you get vaccinated, your likelihood of being admitted is significantly reduced. But with these rates, I think, Councillor, I think the point really is that with rates this high, it's very difficult to create environments that are COVID-free.
Yeah. Thank you, Bob.
Unless there are any other questions, I had one question, and it was just about West Birmingham. My question is, my ward, as everybody knows, is in West Birmingham. We've had some of the highest rates across the city in the west side of the city. The west side of the city is also where predominantly some of our youngest residents are. We've got some of our largest ethnic minorities concentrated in that side of the city. Is there anything extra that the West is doing or the rest of the city is doing to support the west side of the city to get people in to have their vaccines or to go out to them?
So I think, so if I pick that up, Paul, to start with, I think we're working very well with our Birmingham colleagues. We've got a project manager called Mike Ellis, who is responsible for the vaccine program in West Birmingham, and he's doing a fantastic job. We've opened up a range of, I think there's about 20 places in pharmacies, community pharmacies, where people can go. We've had mass vaccination sites open at Aston Villa and at City Hospital, as well as the Millennium Point. We've had engagement events with councillors. We've had councillors going and knocking on doors at weekends. We've created an environment where if you want to have a vaccine, it's very easy for you to have one. What we are behind on is the community support to encourage people to have them. I fully accept that actually in the early phases of the vaccination program, we probably didn't have enough places for people to go that people felt safe to go to. I think that has dramatically changed now. And there are incremental changes that are happening. I think there are improvements in all of our cohort 1 to 9 areas throughout West Birmingham now. I think there are gradual improvements in there, and we never say no to anybody. So if you haven't had a vaccine already and you're in the older age groups, you can still have it right now, and you can go to any one of the places. You won't get turned away. You might have to wait a little while if you walk in, but you can have the vaccine that you need. I think there was the work that we're doing with BSOL in terms of the data is enabling us to drill down in the same way that they have into not just into communities, so that we can understand, in an Afro-Caribbean community, which community in the Afro-Caribbean community is it? Is it the Somali community? We can drill down and see where those gaps are as well. So I think the detail that we would have benefited from earlier on in this program is there now and is enable us to be much more focused. We've set up a call center in West Birmingham, which is calling every patient who's registered with a GP that hasn't been vaccinated, and there is a doctor to support that call center as well to make sure it's not an issue of trying to get into the process of having a vaccination. If you've made your mind up, we need to make it as easy as possible for that vaccine to be delivered to you. So there are a range of things, Councillor. What I would say is, if they're not working, we'll do more stuff. And there's plenty more. If the community comes and tells us that we need to do X, Y, or Z, we will do all of those things as well. It's just the key is to get people in the doors, get them jabbed, and then move on.
Right. Paul, did you want to add to that?
Just to say, Dr. Adams is absolutely right. Just two things. One is that although we still have a way to go, you can see from the figures that over the last 2-3 months we have made an impact. We are chipping away, we are making improvements. And also just to mention what Justin's put in the chat, which is that the door-to-door campaign from the council is being very focused to West Birmingham at the moment, which is great, helps knocking on people's doors and educating them.
Brilliant, brilliant. Can I bring Andy in, please? Andy Cave.
Thank you, Councillor. What I wanted to do is answer your question a little bit about what's happening differently in West Birmingham. I coordinate a group that looks at the comms and engagement in West Birmingham specifically, and what we've really tried to do is actually bring some money down into local communities to fund the comms and engagement that's going on in local wards, and also have that coordinated picture to bring together the providers of the vaccine jabs with those community members having the conversations to make it as easy as possible for people to have their jabs and identify new areas. So there's a real coordinated approach now, really focused on ward-based practice, but engaging those community groups and actually bringing some money down to support that work as well, which is vital for our local communities.
Okay, that's really, really helpful. Can I thank everybody who's contributed to this particular debate, but especially Paul Jennings from the CCG and Dr. Aslam, who have been brilliant as usual. So we will move on to the next item. And the next item is the enforcement update. Now, unfortunately, Gary James, the operations manager, and Chief Superintendent Stephen Graham, they can't be with us today. I have got that right, haven't I? I know that, Justin, I have got that right. We haven't got anybody to talk about this item. Brilliant.
Yes,
they can't be with us today. So what I'm going to ask members to do is to read the item. We have sent you the written information, and we will note the information and move on to the next item. So Errol, can you put it down that it's for noting? Okay.
I will do, Chair.
Okay, thank you for that. Can we move swiftly on to the next item, which Dr. Justin Varney will be speaking about, which is international travel. Justin, over to you.
Thank you, Councillor Hamilton. So we wanted to just have a short item to mention briefly what's happening about international travel at the moment. I know this is an area of interest for many members of the public as people try to plan holidays. So the government in the UK has a model based on countries being designated as red, amber or green. Red countries are countries that you should avoid travel to or from, except for essential purposes like going to a family member funeral, for example. And when you come back from a red country, that's where you have to pay to go into a quarantine hotel and also pay for additional tests. And you have to complete your 10 days of quarantine in a quarantine hotel. And it's very tough to get the exemptions to not quarantine, to be honest. So red countries are red because we are very concerned about either new variants or very, very high levels of cases. Amber countries are countries in which when you come back, you have to isolate, but you isolate at home rather than anywhere else. And you still take these tests that you have to pay for privately. Unfortunately, you can't get the tests on the NHS. They are private tests. And amber countries are ones where we're not quite sure which way the pattern's going to go. Are they going to get worse or are they going to get better? And that's why they're amber. And one of the things that people are quite anxious about is that if an amber country becomes red, then you're going to have to pay for that for the quarantine hotel when you come back. And that's, I think, about £2,000. It's not a small amount of money for people. So that's one of the real challenges at the moment booking a holiday. In green countries, you don't have to isolate. And you don't have to quarantine, which is really good. So, but there's a very small number of green countries. And you can look on the government's website, that gives you the most up-to-date details. The other thing, though, that I wanted to highlight about international travel is that it's not just about what we do in the UK, it's also about the country you're traveling to. So, for example, if you're from the UK at the moment, you can't go to America. North America won't let you in. Because the Americans view us in the UK as being very high risk because of the high number of Delta cases that we have. So it's really important when you are trying to plan holidays that you look at not just what does the UK government say, but also look at the country you're going to and what their requirements are as well. And some of that may change, particularly because the UK has such high levels of the Delta variant. Countries that don't have any Delta variant are kind of saying stay away at the moment. So keep that in mind as well. If you come back from a red country and you have to quarantine in one of the hotels, you go into what's called a managed quarantine setting, an MQS. The majority of them in the West Midlands are based around Birmingham Airport, but there are a couple now in Birmingham that we have, and we've been working closely through environmental health with people running the hotels. They're all commissioned nationally to make sure that they are following the rules, that they are maintaining safety, that the staff working in the hotels are vaccinated to protect them as well. And we monitor to see if there are any outbreaks or clusters linked to the hotels as well. And we maintain with that our right as a local authority to go in and do spot checks to ensure that those hotels are operating the way that we've been told by government that they will. I think the situation is continuing to evolve on travel, and there are now more exemptions coming through for people who've been double vaccinated, not just in the UK, but also internationally. Several countries, I was looking at Switzerland recently, for example, if you've been double vaccinated, then you don't have to quarantine. You still have to do the tests during that first 10 days, but you don't have to quarantine. So it is important to look at that. And it's another reason to go and get your jabs if you're trying to plan your summer holidays as well. Happy to take any questions, but I thought it was useful just to give a bit of an update on what's going on with travel at the moment, given we are coming into the summer holiday period and many people will be considering their holidays.
Right, I don't see any questions, Justin, so I just want to thank you for that item. I have to say I'm really interested in that item because I really want to try and get to Spain this summer, but if I can't do it, I'll just have to take the hit. But it would be really nice, but I would recommend, and I'm considering it myself, stay at home. That is absolutely the best way, and it's far easier than going abroad and getting stuck because the country is then put in the red list. So thank you for that, Justin. Really interesting item. And then the next item I've got is relating to public questions. Now, there have been no public questions submitted for this meeting today. So what we'll do, we'll move swiftly on to the test and trace budget overview. Now, I presume Justin will be doing that.
Yes, that's back to me. And just, I know there's a question from Stephen in the chat just about the international travel and where we should signpost people to. If you go on to, if you put into Google COVID travel and go to the government website, where you can look at individual countries, where you look at the red, amber and green list, that does then link to the individual country page, and the Foreign and Commonwealth Office give you kind of a summary of what they understand the guidance to be, but it usually also has a link to then the government of that country's web page where it tells you all about it. So the best place is start on the .gov website, put in COVID and travel, and then follow your nose from there. So if that makes sense. So on to the finance paper. This is really for information, as you'll be aware, because we're in the kind of end of the first quarter of the financial year. We're still waiting for some of the invoices to come through, so we're a little bit behind spend on where we would expect to be. One of the big questions at the moment is going to be the reimbursement of the costs for the enhanced support. So there is still no clarity about whether there was any additional financial support for what we did while we were enhanced support. And that's to cover the cost of the door-to-door test distribution, the additional facilities that we opened up, that additional work. So at the moment that is being put against the contingency budget, and that is starting to eat into that contingency. So at the next board, we will give a fuller update about spend of the budget. I would say at the moment I am comfortable that we are within the budget and that the provision we set aside for wave 3 response and contingency is covering some of the things that we are having to do at the moment because of the current surge in cases. So we've had to put in additional capacity into the contact centre, for example, because the national system is passing through to us between 200 and 300 people a day who haven't completed NHS test and trace. And the number of people reaching out for support with welfare needs because they're isolating has gone from kind of 10 or 15 a day to nearly 200 a day. So the contact center is now really struggling. So we're putting in additional staff into the contact center to support that. That's creating additional costs. And the other thing that I want the board to be aware of is, as businesses have come back, some of the facilities that we've been able to use during the pandemic for free, they're now saying, no, you can't have it anymore because I need it for my business. So we're then having to look at commercial rent spaces to replace that. So an example of that is the space we have at the wholesale market for storing our lateral flow tests and our testing equipment. Now, because the wholesale market's back at full steam, we can't use that anymore. So we're having to look at a commercial storage space instead, which is going to cost us probably in the tune of about £25,000 to take us through to the early autumn. So there are a series of additional costs that the next board I will be able to present more fully. As I said, I'm comfortable we're not going to be overspent, but I am relieved that we built in wave 3 surge budget and contingency, because we are having to utilise that given the current pressures on the system. Oh, you're still on mute, Councillor Hamilton.
Sorry, I'm wittering on to myself and I must apologise. Can we move swiftly on unless there are any questions? Have I missed anybody who is trying to ask a question? No. So again, thank you for that, Justin. And we'll move swiftly on to, right, I've got to agree this. Is this agreed? Recommendation 2.1, is that agreed? I need somebody to respond to me.
Yes.
Great.
Okay, we'll move swiftly on. Is there any other business? No, no other business, or any other urgent business, should I say? No, nothing there. The final point, the date and the time of the next meeting will be on the 1st of September on Wednesday at 2 o'clock until 4 p.m. And it will also be an online meeting. Can I ask for the exclusion of the public, and can I ask for the camera, the recording to be switched off? And yeah.